day was a blur, literally. Her vision got so bad that one day she woke up and realized she couldn't even see her kids' faces. And she relied on glasses from the pharmacy all the time. Today she has perfect vision, so what did she do? Here with more on the procedure, please welcome back Dr. Julio Arroyo with Eye Health Consultants, along with his patient, Alma Roma Gomez. Good morning. So the last time you were on the show, we had young kids who had what you call corneal molding, and we'll explain what that is in a minute. But the important thing with corneal molding is it stopped the progression of bad eyesight for these kids because they can't have things like LASIK. Now we're kind of on the opposite end of that spectrum, and that's when we turn a certain age and start going like this, going, I can't see, and hope it. That is where you were, Alma. I mean, obviously you couldn't even see your kids' faces.
No, it was all blurry. It is. You know, menopause hits you, then the eyesight, you know, and it started really, you know, I had first pair of glasses, okay, I'll do this.
Yeah,
and
that's
then
the toughest pair, when you break down and go, I have to buy some reading glasses.
I can't read the menus.
Yeah.
And it was so tough. So I started one, then I started another for the car, then I started another for makeup, then I started losing them. So I got mine with the gadget, I could hang it, never lose it. I forgot about it, I would find one and have one here, another one hanging. Like, this is not for me.
Yeah, the reason why they're laughing in the audience because some of y'all can relate, right? Okay, so Dr. Arroyo, that is one way to address the issue, but the concern there is she said her eyes were getting worse, and it's just one of those things that happens to a lot of us during mid-age.
Yes, good morning, Deborah, and everyone. I think, you know, individuals that are farsighted, like Alma, you are blessed all your life. You see great, and at some point you're 40, 45, and you start losing your vision. Mainly up close first. There's a reason for that. The point is that you're not used to those kind of bad news where I was blessed, I had this great vision, what's happening to me? I'm definitely getting old, right? And the reality is that it happens to every one of us. It's something that we all go through, but when you are nearsighted, you don't care, you're used to your glasses, you're fine, but you weren't farsighted, you're spoiled. You don't want to wear glasses now when you're 40, 45. It makes you feel old, it affects females more than males, but I guess everyone. But and that happens because we have this little mechanism inside the eye that flexes, and at some point it stops flexing. In that, so you know, I see my daughter, you know, doing gymnastics, and they say, "Dad, do the same thing. Look." And I say, "Yeah, are you kidding me? I can flex like I used to."
So your eyes can't flex
cannot
like they
do
used
it
to. Yes.
either. So.
Okay, so there are different remedies to this. Like I had glasses since 3rd grade. I couldn't see far away, so I had LASIK years ago, and so I thought I was all set. But then I couldn't see close up, and I didn't want to do LASIK on top of my LASIK, right? So you said do corneal molding, and I thought it sounded like a magic trick. And so explain to folks what corneal molding is.
Well, corneal molding is a non-surgical modality or alternative to vision correction.
So it just molds to that shape.
Exactly. So the cornea is flexible. You're able to mold it. It's a reversible process as well. So you're not destroying, burning, cutting corneal tissue. So it's a natural, more natural approach to
not dangerous at all, which is
correction.
why you can use it on little kids.
That is correct.
Okay, so when he first told me about this, I was like, get out of town. And then he started packing his bags. No, he didn't. No, and I thought, because it just sounded really, and then but it makes sense when you say it molds just like like an Invisalign can mold your teeth, or braces can mold your teeth, except it's much quicker. And I say much quicker, I woke up the next day and it was 20/20 vision or 20/15 vision. And then for you, you're nodding your head.
Yes, that's the same. After going out of his office, I put the molds for a little bit. It was just like an hour or something like that. I took them off, and I took my son with me. I said, we're doing it together, honey. And he had glasses all his life. And the first thing we saw on the wall, oh, I can read that. And he says, Mom, I can see that color. That's not blurry. And we just went out like, wow, let's go and celebrate.
You could see his face. Yeah, no, but it's true, because everything, I was looking at leaves on trees. I mean, you could see your kids' faces from Kansas, couldn't you?
Yes.
Right? It was like, but it is true. You suddenly realize what you have not been seeing is the other thing. And again, totally safe. Just kind of molds the tissue. You sleep in it overnight, and then you take them out in the morning, and then you can see all day. All right, Dr. Arroyo has a special offer for viewers. Get a free consultation and $300 off corneal molding when you mention Great Day Houston. To schedule your appointment at his Houston or Woodlands office, or for more information, you can call 281-419-3355, 281-419-3355. You can also log on to sleepandsee.com. That's literally what it is. You sleep and you wake up seeing. All right, thank you very much.